Okay, I think we will begin. So welcome everyone, and thank you very much for joining this webinar, which we have titled With Every Breath We Make, which is the same title as the white paper that we have just produced on this subject of ensuring healthy air for manufacturing workers. Today we have a fantastic conversation in store. I'm joined by four speakers who will share their views on the importance of healthy air for the manufacturing sector and how we get there. And we have time for Q&A towards the end of the session. We will be wrapped up within the hour. So if I could encourage you all, please, to bring those questions forward. It would be great if we have a good range of questions by the end of the discussion. You can do that by posting your question in the Q&A function. So rather than the chat, feel free to use the chat for your discussion as participants, but in the Q&A box, you can post a question and everyone can vote on the questions that they see and raise the questions up in level of importance. So please do that as we go through the session, and I will pick up questions towards the end. My name is Chris Large. I'm one of the two co-CEOs of Global Action Plan. We are an environmental NGO that is passionate that when we solve environmental problems, we also make human lives better across the planet. And so what's good for us is good for the planet and vice versa. We've been working on air quality for around 8 years and really see that this is an environmental challenge, but also a social justice challenge, a health challenge, and an economic challenge. In that when we reduce air pollution, we improve people's health and well-being. We particularly help those who are most exposed to air pollution, which tend to be the least affluent communities in the country. And we can also increase the productivity of the workforce by reducing the number of sick days, for example. So there are so many benefits to solving air pollution. We've been delighted to work recently with Zehnder on this challenge of air quality in the manufacturing sector. And the result of our discussions and collaborations is a white paper, which you will be able to download and review either while I'm talking or later on today, which explores both the challenge in the sector, how we keep the manufacturing sector being a productive, valuable contribution to the UK's economic output, but also we ensure good, healthy conditions for everyone who's working in those locations. And we feel there is some room for improvement. Martin, if we could just jump on to the next slide, please. I have a range of speakers for us today, and I will introduce them all one by one as we go through the session. And the next slide, please, Martin. And here's how you can find the white paper that we've produced. If you go to cleanairworkplaces.org, you will find the download link there. Now, just before I hand over to Geraint, I'm going to share with you the recommendations. Yes, forward, please, Martin, that's great. So there are 7 recommendations that come out of this report. We're going to go through them in detail through this session. They include that we believe there's a strong argument for reducing the allowed limits of air pollution in the workplace for the sake of employees' health. And there is some new evidence that has come to light since the air pollutants that are controlled had their limits last set. So we think regulators should review those limits. Enforcement could be more proactive in the sector, and we feel there could be some poor practices going unspotted. We think there's a real lack of data. It was very difficult to find out how many people with heart conditions or lung conditions that would be made worse by air pollution, how many of those people are working in the manufacturing workforce, and what is the risk that the manufacturing workforce is exposed to. We then think there's some proactive steps that manufacturers can take, working with union safety reps. And also there's a very compelling business case for addressing air pollution. For example, not only making sure you have a productive and healthy workforce, but also making sure the products that come out of these sites are highest quality they can be, which air quality can damage. And so finally, we also have a thought that perhaps some of the measures that are needed do cost money up front, and perhaps those measures could be covered through a financing by central government, which would cover the upfront costs, but then be paid back over time as the organisation, the manufacturing site, benefits from those measures that have been put in place. So a range of recommendations in the report. I'd thoroughly encourage you to go through the depth of those recommendations in the report itself. And we will talk about them more in this session. So I'm now going to hand over to our speakers. And first of all, we have Geraint Davies, who is an MP and the chair of the All-Party Parliamentary Group on Air Pollution, and an avid campaigner on this subject. So Geraint, if I could have your thoughts, please, on the importance of clean air for workers across the country.
Thank you very much, Chris, and fantastic that Global Action is taking the initiative again on clean air. Today, obviously on Guy Fawkes Day, and we'll see less smoke than ever on this occasion. I'm the chair, as has been said, of the All-Party Group on Air Pollution. We all know air pollution is a massive issue, so globally, 7 million people dying prematurely a year, 64,000 in Britain. And it's also now been linked, of course, to the COVID pandemic, insofar as the Max Planck Institute most recently has found 15% of deaths are linked to air pollution, because transmission and death is higher amongst those people who are exposed to air pollution. There's about 6,000 deaths, as I say. It's a very important moment because the Environment Bill is going through. At the moment, there isn't an obligation to have World Health Organization legally binding limits, but we're pressing for that. And also the issue of indoor air pollution, which is what this seminar is about, is fast going up the agenda. People may know that in any case, people spend 90% of their time indoors, whether it's working or domestically. The focus to a certain extent has been on, avoiding indoor chemicals and in products, volatile organic compounds and the like in sofas, all sorts of issues about fire retardants, etc. Because we're here today to talk about the pollution or the air quality in the working environment. And this is tremendously important. That overall, the country wastes £20 billion a year on health impacts from unclean air. Now, many of these are at work. What we're talking about, of course, is impacts on the heart, the mind, and the lungs. In simple terms, even on a day-to-day basis, poor air quality does impact concentration, cognitive skills in the short term as well as the medium to long term. It impacts on, people's weakness and predisposition towards picking up conditions from flu to COVID. And it does give rise to like 6 million lost work days. This is a great economic opportunity for individual businesses and the economy overall. As I say, if we're wasting 20 billion a year on unclean air, if we had a Clean Air Act or a proper environment bill that reduced that cost just by, say, 3 billion to 17 billion, at interest rates for government less than 1%, they could service a debt of 300 billion on investing in green infrastructure industry. We're spending 200 billion, of course, on COVID, but we need to sort of grow back better. So from a business perspective, we're looking at higher productivity, less working days lost, more enjoyable environment, less likelihood of people leaving a business that's clean and healthy to go to a business that isn't, even if they pay more. So the business case is overwhelming. Obviously, there's also a duty of care case. We all want to do the right thing. There's an environmental case, public health case, and an economic case. So really the recommendations that are being made today by Global Action I sort of fully support, and certainly the need to work collaboratively in partnership with trade unions, which gets the best for the workforce and the best for the business, is of great importance. Some of the recommendations obviously mention the need for spot checks, for regulation and enforcement. As important, if you run a business, as I have indeed, that we keep one step ahead of the game. The businesses that are going to be most profitable, most successful, are looking to a future, and that future is embracing a cleaner, sustainable future, and that will attract business, whether we're selling those or attract workers to work for our businesses, or whether it's set in an economic and an international export environment as well. I sit on the Council of Europe, and in fact, I'm pioneering a template for trade agreements that requires the Paris Agreement compliance is factored in, as well as human rights, democracy, and the rule of law. And the issue here is that as we look at trade being more about bilateral, multilateral agreements, it's important that we do rise to the challenge and we don't sort of step back into the past. We've got a great tradition of this, and it's a great pleasure to share this wonderful panel to discuss this very important issue, groundbreaking issue of clean air to deliver better public health, better health for employers, more business productivity, more business profitability, and showing leadership in the manufacturing environment on a global scale. So thank you, Chris.
Thank you very much, Geraint, for that overview. And if there are questions specifically for Geraint, then please do put them in the box relatively quickly, as we may lose Geraint at 1:30, but I will try and get questions to him before then. Okay. Now, I'm going to hand over to Hilda Palmer, who has been campaigning on this subject for a long time. And Hilda, I think you're going to give us an overview, aren't you, of the challenges that you are aware of in the manufacturing sector and just how important it is that we tackle this problem.
Thank you. Thank you very much. Thanks very much to Global Action Plan and Zehnder for inviting us to speak today. I'm from the Hazards Campaign, and the Hazards Campaign and the Hazard Magazine has been working with the TUC and trade unions, workers, and especially safety reps for well over 30 years on trying to make work safer, and especially to improve workers' health. Workers' health is massively ignored and neglected, and we learn that to our cost now during this COVID epidemic. As Geraint has already mentioned, not only does the air pollution in the workplace and outside spread COVID, but also by having damaged workers' health and the health of the public, it actually means that people are becoming ill or dying because of their past exposure to air pollution at work. A lot of the older people who are dying, it's because they've been massively overexposed at work. And it's also highlighted the fact that we have very, very poor health and safety standards in workplaces and very, very poor enforcement. And particularly we have workplace outbreaks occurring because of lack of enforcement, because of lack of employers actually looking after ventilation at work. And so airborne transmission of COVID is happening, and we're having massive outbreaks, and that is fueling the COVID epidemic. And so these are very important points. Recently, we've been working with Greener Jobs Alliance and trade unions in the Trade Union Clean Air Network, TUCAN, to focus on reducing air pollution at work and linking it with the issue of air pollution outside of work, and trying to make sure that all the solutions that are being proposed are equal, fair and just, and actually improve workers' lives and health, don't cost jobs and don't make things worse. So we very much welcome this white paper, anything that draws attention to this issue and to reducing the exposures of workers to toxic substances at work. And I just must say that we must make sure that we're including everything. This means chemicals and dust used in raw materials, whatever arises from the work process, the chemicals in the final product, the chemicals in the waste streams in air and water, chemicals in cleaning and ground maintenance that affect workers, and chemicals in the fabric of the building, asbestos and dust, and chemicals in furniture and upholstering carpets, as Geraint has explained. All these things are actually very important in the workplace and all add to the toxic soup of chemicals in which workers work. And a lot of this, of course, is completely invisible. We're talking about micro and nanoparticles and fumes and aerosols in the air that you can't see. But since the dark satanic mills of the Industrial Revolution, trade unions and workers have been fighting not just for better wages and fewer hours, but against hazardous substances and doing very well. And that's really why we have the regulations and the protection we have today. But they're still massively overexposed. Workers are the canaries in the coal mine. They're exposed first, they're exposed most, and they're often thought about and protected last, if at all. And most of the current problems that we have of climate change, the need to go to zero carbon, of air pollution, and of plastic and other pollution originate in work. And so by focusing on these things, work is essential to all of this. By focusing on work, we can actually reduce a lot of these things at source while improving workers' health. We support the white paper recommendations for lower work environment limits. There aren't many work environment limits. They're not set on health standards. They're set on what's technically and economically feasible. There are too few of them. They're too poorly enforced. And they're particularly bad for things like respirable and inhalable dust. The Hazards campaign has got its own campaign going on at the moment, the Choked campaign, trying to reduce the silica dust exposure level. So we support the call for more enforcement of the control of substances hazardous to health regulations particularly. These cover all chemicals and dusts and microbes, bacteria, fungi, and viruses, of course, and the COVID virus at the moment. And we support more action to prevent all the exposure routes. I think we must just say here that the HSE has been cut by 50% over the last 10 years, only has 390 frontline inspectors, does very little proactive inspections because they've been banned. The reporting is absolutely poor. They ignore women's health exposures. They're doing very little on carcinogens, endocrine disruptors, and all the rest of it. And so they have very, very little or too little understanding of what's actually going on. Our approach is for a precautionary approach, a preventative approach, a protective approach, and a participatory approach. This must all go on with workers and safety reps at the heart of it. So we support the call for more enforcement of the control hierarchy of COSH. Elimination. If there's no hazard, there's no risk. Safer substitutions. We've had substitutions in the past that have protected the environment but been very bad for workers, like trichloroethane going back to trichloroethylene. We must have safer substitutions. And for engineering controls, which is where Zehnder comes in, and administrative controls and PPE only as a last resort. There are no safe levels of mutagens, endocrine disrupting chemicals, reproductive hazards, and carcinogens, or for particulate matter, anything below PM 2.5, nanoparticles and all the rest of it. So we have to eliminate and control all these substances at source. So your white paper draws attention to the cause that we've been fighting for a long time, and it will help. And it will also help in terms of justice and equality. Generally, the lower your pay, the more likely you are to go to work in toxic polluted air, to work in toxic polluted air, to live in it, to send your kids to school in it, and to have your life and their life shortened by it. And when you add in race and sex, the mixture just gets a great deal more toxic. So improving air quality at work will reduce social and occupational health inequalities. So Toucan and the Hazards campaign and the Greener Jobs Alliance, we want toxic substances at work to be reduced. If we get toxic substances out of work, we're getting them out of the air, out of the water, out of the soil, out of the products we use, out of our homes, out of the environment, out of our air, out of our bodies and our lives. And improving workers' health must be at the heart of all of this. Thank you very much.
Thank you, Hilda. It's fantastic to have you here to lend us your years of experience of really understanding the detail of how the regulation and enforcement system works. And I'd welcome any detailed questions. We'll point them towards you later on, Hilda.
Please.
Now, I know, so we were going to go in the order of Ben and then Kate, but I know, Kate, you have an emergency to get to in the factory, don't you? So perhaps we'll just switch that around, and we're gonna focus more on the solutions. So I'll come to you first, Kate. Kate is a worker in a manufacturing organisation, Aerofab, and you have been involved in trying to improve the air quality, haven't you, throughout the organisation? Perhaps if you could share us your experiences and the benefits that you have experienced when air pollution has been improved, and then we can let you rush off to get on top of the emergency.
Yeah, okay, that's fantastic. I have to say I am in awe of Hilda, really. I'll try and do my best. So yeah, you've asked me to come along as a case study, and we are a classic metal fabricating company. We've been going for about 30 years. The factory has probably been built around about the 1950s, 60s, and it has a license attached to it, which means that it's heavy, so we can produce fabricated items. I know that when I was starting to look for maybe a cleaner, more efficient factory in a local area, I really struggled. So that was one of the things I wanted to raise, is there doesn't appear to be many new factories being built with a heavy license. So therefore we're stuck. So we're staying in this factory. And when I first started to look at the air quality, I inherited fixed and portable ducting, which is traditional. It's not efficient. And as the company got bigger and bigger, it got to the situation where I was going onto the shop floor and literally it was a fog. I could see it, I could taste it, I could smell the air quality, and I was really, really concerned. I started campaigning through the risk assessments to the owners. Come on, we've got to do something about this. He actually had a son and daughter on the shop floor as well, so you know, but it still took a long time to eventually get the funding. But in 2018, we went for it and we started spending money on extraction. We got in touch with Zehnder units, and they were absolutely fantastic for us, because they came in, they did the air monitoring, they took samples post and pre-installation, and they pretty much handled the whole thing. So we did that, and I have to say it is expensive. It is very expensive. We then decided that that still wasn't enough. We wanted to protect our employees even further. So we introduced full face respirators. And literally within 24 hours of putting those two things together, we were still using the existing ducting. I had quite a few of our shop floor guys come up to me and say, you know what, Kate, I used to go home, and when I get home, I'd, for example, blow my nose and it would be black. And literally overnight, when we did this, the Zehnder units and the face masks, they said, nothing. I have absolutely nothing when I go home now. And they could see in the filters when they were replacing them how black they were. And all of that is now stopped. You know, they're protected from that, because it is hard to change the culture on the shop floor. You know, wearing a face mask all day long I would imagine is difficult. I haven't had to do it. And I've had to give them reasons why we've got to carry on doing this. You know, a lot of them are young men. They're going to be in this industry for a long time. And like Hilda was saying, for us, it's unavoidable. We're manufacturing, we're making things. We are going to make noise, we are going to make pollutants, but I think Aerofab has taken the gold standard approach. I'd never really thought about it as us almost trailblazing on this, but when I looked around, I don't know of any other local manufacturers that have invested the kind of money that we've done. I mean, I don't know what else to say on that subject really, but it was, and I can go on the shop floor now and I can't see it, I can't taste it, I can't smell it anymore. And one of the reports that I saw from Zehnder, it was a 70% reduction. And the other thing is as well, we're capturing those particles. In the olden days, it was just extracted to atmosphere. So, you know, it's not just about the people on the shop floor, it's the atmosphere as well that we're helping to protect, or at least I'd like to think that.
Fantastic, thank you, Kate. And can I ask, other than the black bogies, is there anything else that the workforce have been saying, or I don't know whether you've been able to study the absences, sick days, whether you have people who perhaps have asthma working in the workforce who've talked about it. What do people say when they compare what it felt like to work in the factory to how it feels now?
So I would like to think that everybody recognises the efforts that we've gone to, and I'm not aware of any incidences that I would class were breathing related in the last few years, which you know, to be honest, I never really tried to put two and two together. Our sit record is pretty good. So I guess if everything's ticking along nicely, you don't really ask too many questions, I suppose. I know that the guys on the shop floor are very positive about it because you need their support. As I said, because it is to wear a face mask all day long is a big ask, but they understand the reasons why. And they can see that everybody else is doing the same. And it was a really positive feedback when we brought all these this extraction into the factory.
Thank you, Kate. And I know you have to dash. Just before you do, we have one question which I think is directed to you. Is about how often the filters are replaced within the filtration units that you're using. Do you know that technical detail? How often the filters need to be replaced?
I don't know the technical detail, but once a week minimum. So basically there's several layers within the full face respirators. And really you should be changing those once a week. With the Zehnder units, you know, I'm not too sure anymore, but they just come along and sort that out for you at regular points. I would imagine every 3 months, probably.
Well, I'm sure Ben will fill us in on the technical front on the Zehnder units. Well, thank you very much, Kate, and we won't detain you any longer from resolving your emergency situation, and keep up the good work. I'm sure it's very, very much appreciated by the workforce.
Thank you.
Okay, now, Geraint, I know we are just about to lose you, so if I can come to you with a couple of questions, and then I will get back on my agenda and come to Ben to also talk about the solutions. So, there is a question here, Geraint, on that the HSE has released some stats. I'm not aware of them personally, but there are stats which say occupational asthma is a rising trend. Do you have any insight on that? Do you, and if it is the case, who do you think should be looking at this?
Yeah, well, asthma is a big problem, both from chemicals in, I mean, Hilda gave a fantastic presentation, as with the other presentation, but I mean, asthma is driven by outdoor air pollution and indoor air pollution. So there'll be no surprise that, you know, poor quality air in places of work is driving asthma, as it is allergies. We do need to get on top of this. Again, Hilda mentioned the issue of chemicals. There's supposed to be chemicals that are included in the Environment Bill as well, even though they won't allow us to, at the moment, to have indoor air pollution. But clearly we do need to have regulation of sort of endocrine disrupting and other, either by touch or through airborne chemicals that are affecting us in our daily environment. So there's two different things in a way. There's a sort of cleanliness, cleaning up the air, and then stopping the chemicals in the supply chain and in the environment that's impregnating the air and possibly impregnating people directly through the skin and through the clothes. See, I'm rambling a bit here, but clearly there is a need for those regulations. I'm putting forward a private member's bill actually on dangerous chemicals, and the idea there would be to basically put forward suggestions, as Zehnder again said, on the precautionary approach as well, that would include indoor air quality, but also chemicals generally that people are exposed to, mainly in work, but sometimes domestically. You can buy all sorts of horrible things and people don't really realize how much harm it's doing them. Clearly it's doing a lot more harm if you're exposed to them day in, day out. And finally, on the mask point that was made, you know, I am pressing actually that masks should be worn in schools. I mean, people don't want to wear masks, as we've just heard, but it is a, you know, a big issue. It's a big issue for stopping transmission, but also protection as well.
Fantastic, thank you, Geraint. Do you have to leave us now, or do we hold on to you?
I've already got another 5 minutes or so. I think someone's going to start phoning me in a minute. I've got to be doing something about 5 to 1, but I will leave in a minute. I'm sorry about that.
Okay. Well, if you disappear in the background, thank you very much for joining us.
My pleasure, thank you.
Okay, now I'm going to turn to Ben, who is the UK lead at Zehnder, and has been involved in figuring out how we tackle this problem in manufacturing sites, which, as we've heard, inevitably will produce airborne hazards through the nature of their operations. We've seen, Ben, that the CBI believes there's £1.6 billion of economic productivity to be gained by getting World Health Organization, getting air quality down to World Health Organization limits across the country. That's the outdoor air quality. How do you think this is going to also play out for manufacturing? What do you think are the benefits within that the manufacturing sector could see if we really get on top of this air quality problem?
Yeah, sure. Well, thanks, Chris. And firstly, good afternoon, everybody. I think firstly, I just want to say how delighted we are to be supporting this important work with Global Action Plan. And probably, Chris, the best way that I can answer your question is maybe just to take a couple of minutes to just explain a little bit about Zehnder for those people that are not familiar with us, but more importantly, what we've learned over the recent years with our work in this marketplace. So as I say, for those people that aren't familiar with Zehnder, we're long established. We've been going since 1895. And for most of our history, we've been focused on creating the best possible indoor climates for our customers. And in the last decade, that's led us to invest in our clean air solution side of our business. And we've done that on the back of our unique filtration technology, as well as Kate's already alluded to what we like to think of as a very user-friendly business model. Now, specifically in the last 5 years in the UK, we've seen a real increase in demand from customers within the industrial sector for cleaner air. And obviously a lot of our experiences that we've gained underpin what we've tried to put into this project as well. And I think the best way for me to get this across to everybody is to talk about what a typical Zehnder customer looks like. So a typical Zehnder customer in the manufacturing sector is manufacturing and they're shipping a product. And that product could be all sorts. It could range from a car, it could be a cake, it could be a brick. Now, every one of those businesses is different. But what they do have in common is they all produce airborne waste at some point in those manufacturing processes. And that could be from welding, it could be cutting, baking, spray molding, lots of different processes. But the way that that's going to manifest itself is normally with a dust or a fume that becomes airborne. And as Kate mentioned, when we first went into Aerofab, we could clearly see in the air mist, a haze or a fog, as she called it, in the air. Having said that, quite often, the particles that are released, they're actually invisible to the naked eye. And what that means is that within the workplace, without measuring equipment, it's impossible to know what's hanging in the air or how much of it's hanging in the air. And when we first go and meet a customer for the first time, we look for telltale signs, things like dust that's actually on surfaces, the taste of the air, as well as listening to what the workers there actually tell us. Now, the most obvious issue with that we see is first of all, the substances that business is using can be harmful, and Hilda covered this, I think, excellently in her piece. And excessive exposure in the workforce can obviously, to those harmful substances can obviously cause some really serious health issues. And I think the white paper outlines that quite well. That's normally covered by the workplace exposure limits, and ultimately it's the business's responsibility to monitor that exposure. But I think the second issue is slightly less well understood, and that's that even if the airborne waste that business is producing is relatively benign, high quantities of dust can still be, fine dust can still be breathed in by workers. Now, when we talk with customers about that fine dust, we talk about it in terms of particle matter, so PM of different sizes. And essentially, the smaller particles will tend to hang in the air for longer. But obviously, if they're breathed in, they can also penetrate more deeply into the lungs and potentially the bloodstream. So obviously, at best, that creates an unpleasant and a particularly uninviting working environment. And at worst, there's the potential for serious health issues there. Just to give you an idea on particulate matter, though, it's far less regulated than the workplace exposure limits. And in all cases, the UK legal levels are well above the World Health Organization's that have been mentioned before. So to give you an example, the World Health Organization recommended exposure limit for PM 2.5 is 25 micrograms. The UK legal limit is 160 times that number. And we know the World Health Organization considers PM 2.5 to be a carcinogen. So to go back to our customers, what we find is when starting to work with the customers, we, as Kate mentioned earlier, we carry out an initial measurement to establish a baseline of the particulate matter that we need to remove. What we found alarming, though, is before we did anything, before we intervened, out of all those air quality measurements that we've taken over the years, when we look back, actually 2/3 of those were above the World Health Organization's recommended levels. Okay. The important thing, though, is that despite what we found, is a typical Zehnder customer is still operating within the UK legal framework. They're not breaking the law. And very few customers pick up the phone and call us because they felt they've got an issue complying with the current legal standards. However, as you heard from Kate, what they're concerned about is making sure that their workforce are protected, not only for now, but for the years to come. They want to be seen to be responsible employers. But equally, a lot of them over time will come to understand the costs of poor air quality. And to put it bluntly, I mean, the more dust, the more fumes you create, it's got to be cleaned up at some point. If it's not being breathed in, it's going to land somewhere. And for businesses that can be subject, as a lot of manufacturers are, to audits, the time spent to keep those facilities hygienic and clean can be really significant. But not only that, those dust and fumes, if they're going to fall somewhere, potentially they're going to get into manufacturing equipment, and there is potentially an impact there on the lifespan and the amount of investment that needs to go into maintenance on that equipment. Equally, if it falls onto products, the products, if it's covered in a layer of dust, it can affect the quality of it, and that means wastage, reworks, and we work with lots of customers on that side of things. And there's a really significant return on investment there if handled correctly. The bottom line is that dirty air is bad for the bottom line. So to come full circle, that's why we're involved with Global Action Plan on this white paper. We want to highlight this, that there's an increasingly strong body of evidence, not only for government to act, but I think crucially for businesses to take a lead on this. Not only because it's the right thing to do for their workforce, but actually it's the right thing to do for the prosperity for the business. And I think given where we are now and looking forward to maybe what we want a post-COVID world to look like, I don't think there's ever been a better time for us to start this conversation now.
Fantastic, thank you, Ben. And I'm going to keep you online, Ben, and also ask Martin if you can put the recommendation slide back up on the screen for us, please, Martin. So Ben, we talked about these recommendations as a wish list, which is a combination for government and regulators, but also for manufacturers themselves. And I ran through these at the beginning. What's your thought about the importance of taking on these recommendations? Yeah,
well, I mean, firstly, when we were involved in this, I was delighted to see the recommendations, and I think there's some really excellent stuff in there. And I think the first thing on the regulation point of view, and one thing that really surprised me was, I've just talked just now about the particulate matter standards. And I mean, the crazy thing is, when you think about the last time that the PM10 standards were reviewed in the UK was 1984, and they're currently 200 times the World Health Organization's recommended levels. So there is clearly a case to say that that's overdue. And in fact, in the white paper, we are echoing calls that the TOC and the Institute of Medicine have made, not recently, but years ago, that these need to be reviewed and reduced. So we think that's long overdue. And you cited earlier, Chris, and I think it's a really important stat, that a reduction in 10 micrograms in air pollution, the CBI reckons that leads to a 6% increase in productivity. Well, it doesn't take a lot to do the sums on that. You can break that down to a business, but the economy as a whole, there's a huge opportunity there.
Fantastic. Thank you, Ben. Thank you. Just to come back on that very last statistic, which I think is really interesting. There was a study in a factory in the US which found that 10 microgram change led to a 6% decrease in productivity when air pollution increased by 10%. So by 10 micrograms. Get my words right. So 10 microgram increase in air pollution led to a 6% drop in productivity. The allowable level of the same pollutant, PM2.5, in UK workplaces is 4,000 micrograms. If we think that a 10 microgram change could lead to a 6% change in productivity, then anyone who's even working at the legal limits could be seeing a huge, enormous change to productivity by addressing that pollution level. Hilda, we have a question that has come through for you, which I'm going to jump straight to. As I've had great comment from you already on the recommendations, but we have a question about how we can understand the impact of the workplace on health and respiratory conditions. The question from Amasa, which we know for sure that occupational, that the health issues are linked to the occupation, so that's not in doubt. But do we know, and is there evidence as to whether the health problems caused by the workplace are from workplaces which are not meeting the exposure limits, which have illegal levels of pollution, or is it from just the workplaces which are meeting the limits, but the limits themselves allow a dangerous level of pollution? Do we know from the data what's going on there? Is it a bit of both, or is it one or the other?
That's a really, really good question, and it is really a bit of both. The real problem is I try not to go on too much in my talk, but the real problem is that we don't actually know enough about what's going on in actual workplaces to actually say that. We believe, and we know from lots of scientific studies, and your paper itself accepts, that the levels that are set are not safe levels. We know that, we know they're too high, so we know there's some of that going on. We couldn't exactly quantify that, but we don't actually know how well most companies are doing in terms of keeping the levels down where there are work environment limits set. And they're only set for a small number of chemicals. We just don't know this. The HSE used to go out and do a lot of proactive checks to see how employers were doing on complying with regulations. That was banned in about 2013. You weren't allowed to go out into most workplaces and actually just see what people were doing. The HSE was only allowed to arrive with the ambulances and the emergency services when somebody had been hurt, something had been reported, or somebody had been killed. So the HSE has very, very little intelligence on what's really going on in workplaces. It has far too little data. It makes much more of the data it has than can really be sustained. Occupational health within the HSE, there's only about, well, I don't know, 2 or 3 specialists in the HSE for the whole of the country. They've been absolutely decimated, and we don't have that information. The reporting of occupational illnesses and of all this sort of information to the HSE through reporting of injuries, diseases and dangerous occurrences regulations, RIDDOR, is very massively underreported, gives them very little information. Occupational health doctors in the HSE have said that they only get reported about 0.3% of all occupational illness at work. So the HSE guesses from using other proxy measures like the labour force survey, which isn't really accurate, and some specialist occupational lung and other mechanisms that give them this information. So it's a very, very, very good question. We think from the evidence that we have, so outside of that, that it's obviously both of those, and we believe that, you know, a lot of the biggest problem is probably people not complying with those limits and keeping it down. But we know that the limits that are set are too low. But the reality is, because we have decimated regulation under the idea that it's a burden on business, it's stupid red tape, we don't need to bother about it. We've decimated regulation and its enforcement. We don't have that information, and so we can't actually properly do enough about it. It's a huge gap in our knowledge.
Thank you, Hilda, for that clear explanation. This is exactly why recommendation 4 is in the white paper, which is that we simply don't know. As an environmental and air quality campaigning organisation, when we came to look at this issue, we were staggered by how little is understood about the level of air quality in manufacturing places across the country and the incidence of air pollution related health challenges in that workforce. And so the labour force survey, for example, asks workers to self-diagnose and figure out whether it is their workplace which is causing their health issue. And a doctor really struggled to do that. So find it that there's a real lack of understanding about what's driving the health problems and how severe they are. So that's why recommendation 4 is in this list. Ben, I wanted to come back to you on recommendation 7, the last one in the list, just to think about the feasibility of this. So we are a campaigning org. We think that, and Kate said this, that there is an upfront cost to putting these measures in place, but the theory goes that will be offset by reduced staff illness, improved productivity, improved perhaps quality of the product and the output of the factory. What's the feasibility of the business being able to see financial benefits in a way that they would be able to pay back a loan if a government was to offer one, without ever sort of being out of pocket themselves as a business? Could that work?
Yeah, I really think it could. And I think recommendations 6 and 7 are really closely linked. And this is a really important point, because we've talked about the health risks, and that's absolutely crucial. And there's a strong case in that alone for what we're advocating here today. Having said that, what we also need to get the message to businesses that the positive case for clean air. So that if you do things in a really structured manner, and if manufacturers approach it in the same way that they would approach a manufacturing which is you measure what your challenges are and your problems, you put KPIs in place, and then you monitor that moving forward. That's the best method to make changes. And service partners like us at Zehnder, but I'm sure over time there will be more out there as well. That's where we come in and where we can help, because it's not always the case, as Kate said, about we'll just get in Zehnder and we'll cover everything. It's normally a combination of a few different things that really gets you a difference in air quality. For example, when we first started in the UK market, a lot of people have said to us, well, actually local extraction is the answer to everything. And LEV is a solution, but it doesn't cover everything. And our customers tell us that. And actually some of the authorities tell us that as well. You need to quite often have a combination of different solutions. But if that's done right, and if that's done with a really good, smart business head on where you think about the return on investment, you can not only improve the workplace health, but you can also identify areas where you can cut out some of the hidden costs that are currently being taken by the business. And that's going to be different. So every manufacturing business is different. So they need to be able to sit down and actually really analyze what they're doing, as I say, with the same level of rigor that they would an actual manufacturing project itself. And then where the government can come in, I think, and really support this is, we know at the moment government's paying for everything. Literally, while we've been talking, they've extended the furlough scheme again. So, this is not about us going to government and saying, you need to give money away. It's more about saying, what we need from government now is we need some investment that will pay back and that underlines what we're saying about the fact that it will lead to an increase in productivity. There are huge gains to be made for the individual businesses, but for the wider economy. And the government in the long term is only going to benefit from that. So again, to recap, I think 6 and 7 are really crucial. And if we can get both of those right, great.
Fantastic. Sorry, I was still muted there. Right, now we are just about at our time, but I think I can squeeze in and rapidly run through a couple more questions that we've had coming in. Hilda, I'll come to you first on 2 questions. One is this just a PM issue, a particulate matter issue, or is it a wider pollution challenge? And then to both of you, would a sort of air quality star rating system for workplaces help in a way that we perhaps have a star rating system for restaurants? And if so, what might that look like? So Hilda, I'll come to you first on your thoughts on both of those 2 questions.
It's not, I don't think it is just a particulate matter issue. I think it is a much broader chemical issue. And so we must always talk about chemicals and dusts and particulate matter. Although I think obviously we have learned more recently about how seriously important particles are, and small particles particularly. And of course, at the moment, we're looking at aerosol airborne transmission of COVID, which is making that all a lot clearer. I think a star rating would be excellent, but on health and safety generally. And in fact, I believe that workplaces shouldn't be able to set up and operate before they could actually do that. And when you went for a job, you should be able to ask for the star rating for all of these things, and it should be up on the door of all workplaces. But that would require, I think we should do that. That would require a very big a change, and it would require government and employers to actually say that workers' health actually did really matter and put it up there at the beginning. The only reason it doesn't matter is because we have a skewed accounting system, which doesn't make making workers' health and clean air and all the rest of it actually a positive, where we have to actually make that case in a more difficult way.
Fantastic, thank you. And Ben, what are your thoughts on a star rating system?
Yeah, I really like the idea. I think anything that we can do that tends to openness and transparency, but also a certain level of accountability for the air quality within those businesses is a good idea. And I think that comes back to what I was saying before. You've got to understand what the scale of your challenges are. And as I said earlier, every business is different. But I think if you give something where it's open, transparent, public, what the air quality is like, and it also gives businesses something to aspire to, I think that's good for employees. I think it's good for the businesses as well. Because as I mentioned earlier, a lot of the people that we are working with, and Kate is one of them, they want to be seen to be employees that are doing the right thing, that are looking after their staff, not only in terms of what they experience today, but also in terms of their health for the long term as well.
Fantastic, thank you, Ben. Martin, just as I wrap up, could you put a link to the white paper in the chat function, please, so that everyone can easily access it for download? So I work up very briefly. I see there's a question in here: do we want to help to help hospitals in a similar way? Are there other situations where air quality is a challenge? And I'll take the one myself, which is yes, is the answer. We have been working with hospitals over the last few years to both reduce their air pollution footprint, to improve their indoor air quality, and also engage health professionals in providing advice to patients on how to avoid the highest exposures of air pollution. And so we would highly recommend that hospitals do have more support to address the air quality challenge, and they are at the moment in the middle of a whole different crisis. And I certainly wouldn't want to be loading an extra thing onto the workload of the NHS at the moment, but I think extra help would always be welcome from the NHS. We created the Clean Air Hospital Framework, and that is available to download from our website as well. If you go to cleanairhospitals.org, you will find a framework to create a strategy with any hospital to address air pollution. And we put that together with Great Ormond Street Hospital, which was the first hospital, definitely in the UK, potentially in the whole world, to create its own clean air strategy. and the framework enables any hospital to follow suit. Now, I must say thank you to all of our fantastic speakers today, to Geraint Davies, to Kate Burgess of Aerofab, Hilda Palmer of the Hazards Campaign and Greener Jobs Alliance, and also Ben Simons, Head of Clean Air Solutions for Europe West at Zehnder. I would encourage all of you to download that white paper, which you can get at cleanairworkplaces.org.uk. And I would also encourage you to do what you can to push for those recommendations to be adopted. Whenever you happen to see your local MP again, when you feel like tweeting at your local politicians, and through any of your conversations with local authorities and the health and safety executive, there are points there that can be raised in all of your conversations on this subject. It's absolutely vital that we give our crucial manufacturing employees, that workforce, we give them the best chance of having a healthy life through the conditions in their workplace. So thank you all very much for joining the session, and I will close it there and say goodbye. Thank you, everyone.